Hello everyone. As we have discussed earlier, that who are the couples who require IVF or what are the investigation examinations you need to undergo before you start your IVF treatment. So now you might be curious to know what is IVF and how it is done. What are the steps of IVF? Yes, we are going to discuss today IVF procedure, how it is performed and what are the steps it includes. So if you have any queries regarding this, do write them in the comment section and I'll reply to all your queries after this session. I am Dr. Aashita Jain, fertility expert, Bavishi Fertility Institute. IVF or in vitro fertilization, which in general term is known as test tube baby, is a procedure in which eggs and sperms are fertilized outside the body under the strict lab conditions, and then the embryo formed is transferred into the female's uterus. IVF is a cutting edge technology in fertility and it involves the 7 golden steps. So let's see what are the steps involved in the IVF. There are 7 steps from ovarian stimulation to embryo transfer and to follow-ups. The first step is ovarian stimulation. The stimulation phase in every female starts from the day 1 of their menstrual cycle. Naturally, a woman produces 1 egg every month. But in IVF, we give medications on daily basis from around 10 to 12 days to produce a larger number of eggs. The medications given are in the form of injections and that are of FSH and LH, that is follicle stimulating hormone or luteinizing hormone, and these injections are given daily. Then the response of this injection is monitored with the help of ultrasound and hormonal test. On the ultrasound, we see how the follicles are growing, whether they have grown or increased in the size or not, and the dose of the injections are adjusted accordingly. The sonography in the later part of the stimulation is done more frequently to plan trigger injection. Trigger injection is the one which will help the egg or prepare the egg for ovulation. We generally tell you the exact time when to take the trigger injection because accordingly we will plan the ovum pickup or the egg retrieval procedure, and it is generally planned 34 to 36 hours after the trigger injection before the eggs are released in the body. So in the stimulation phase or the stimulated ovaries looks like this. These are both the ovaries where follicles have grown larger in size. So this is how a stimulated ovary looks like. So stimulation and the maturation of the eggs form a very important part of the IVF cycle. Hence it is the first step which is followed by the trigger and then the ovum pickup is planned. So next steps comes the egg retrieval or the ovum pickup. Once the follicles have grown bigger in size, then the ovum pickup is planned. It is a daycare procedure and is performed under anesthesia. It is a procedure of minimum 15 to 20 minutes. In this procedure, with the help of sonography, a needle is passed from the vagina into the ovaries and the follicular fluid is aspirated, and this aspirated fluid is then handed over to the lab to separate the eggs. So this is how an ovum pickup looks like. This is the probe of the ultrasound machine on which the needle is fitted, and with the help of this ultrasound we go from the vagina into the ovaries, and with the help of this needle the follicles are aspirated and the fluid aspirated is collected into this tube. This is the ultrasonographic picture in which you can see this is the ovaries and these are the follicles containing fluid, and this white thing is the needle which is gone inside the follicle to aspirate the fluid. This is how an ovum pickup looks like. The recovery from the ovum pickup generally occurs within the 30 minutes and you can go by your own. And from the next day, you can resume all your activities. After the ovum pickup comes the sperm preparation. If you are a couple who is planning for the fresh sperm, then you have to produce semen on the day of the ovum pickup. And if the frozen sperms are used, they are already prepared in the lab. The sperm is then graded as per the quality levels. Sperms are washed into a medium because of which the motility is reduced and it will help us to select the better quality sperms. A better quality sperm is neither too thin nor too fat and neither it has a long tail nor a too short tail. All the better quality sperms are selected and kept in the lab. So after sperm preparation comes the fertilization. When the fluid is collected from the follicles, it is handed over to the embryologist, where the embryologist looks under the high power microscope and separates the egg from this fluid. These eggs are then kept in a petri dish along with the sperms to get fertilized. In this technique, the sperms fertilizes the egg on their own like it happens naturally in a body. And this is known as a conventional IVF, which has now been replaced by an advanced technique that is ICSI, which we will be going to discuss in our next session. So this is how a conventional IVF looks like. This is a petri dish in which these eggs and the sperms are kept together for fertilization. So after fertilization comes the embryo development. When the egg fertilizes with the sperm, embryo is formed. This embryo is then kept in the incubator where the environment is as such similar to that of a body and hence it aids the embryos for the development. The embryologist looks after the embryos for 3 to 5 days for their growth and development. Generally, a day 2 embryo might have 2 to 4 cells and day 3 might have 6 to 8 cells. And nowadays, the best embryo is the day 5, that is the blastocyst, because with this, the chances of achieving a pregnancy are very high. So the embryos under the microscope looks like this. These are day 1 embryos, these are day 2, day 3, day 4 and day 5. So the embryos under the microscope looks like this. We generally transfer 2 or 3 embryos so that we can minimize the risk to the female and the baby during the pregnancy. The extra embryos can be freezed as per the choice of the patient. After the embryo development comes the embryo transfer. Embryo transfer is a procedure in which once the embryos are developed, now these embryos will be transferred back to the female uterus. Embryo transfer is a very simple procedure and it does not require anesthesia. It is a minimum 5-minute procedure. In this procedure, the embryos are loaded into a fine tube known as catheter, and then this catheter is passed from the cervix, that is mouth of the uterus, into the uterus and the embryos are transferred there. So this is how an embryo transfer looks like. These are the embryos which are loaded in this catheter, and this catheter is then passed through the cervix into the uterus where the embryos are transferred. In the sonography, it looks like this. It's the uterus, and the white you can see is the catheter which is going inside the uterus, and the other embryos are transferred. So this is how an embryo transfer procedure looks like. After the embryo transfer, you can move around or use a washroom, because generally many people worry that moving after embryo transfer might lead to fall of the embryos, but it doesn't happen. So you can move around freely and you can resume all your activities after the embryo transfer. After embryo transfer comes the blood test, by which we'll come to know whether you have conceived or not. This blood test is performed 2 weeks after the embryo transfer. In this blood test, we test HCG or human chorionic gonadotropin hormone. If this hormone is present in your blood, then this means that you have conceived or you are pregnant, which is later confirmed by ultrasonography, which we perform 2 weeks after the test, in which we can see the pregnancy and whether the heartbeat has come or not. So if you opt for IVF treatment and your IVF procedure includes some extra steps, it is because it has been tailored according to your medical needs. Because an IVF procedure planned and tailored according to a couple needs always gives a better success rate. So through all the exhaustion of medications, embryo transfer and follow-ups, do keep your spirits high, because your efforts at the end will definitely pay you. And still, if you have any queries, do write them in comment section and I'll reply to all your queries. Thank you so much.